Hello friends. Eating disorders are significant mental and physical illnesses. These issues include eating, weight, and body image issues. These symptoms can impact your health, emotions, and life. Symptoms. Symptoms vary by eating disorder. Most eating disorders are anorexia, bulimia, and binge eating. Eating problems affect people of all sizes. Anorexia. Anorexia, anorexia, is a life-threatening eating disorder. It comprises abnormally low body weight, strong dread of gaining weight, and an unrealistic image of weight and appearance. Extreme weight and shape control in anorexia can harm health and daily life. Anorexia may involve substantially restricting calories or food types. It may require excessive exercise, laxatives, diet pills, or vomiting after eating. Even if you eat regularly, weight loss can harm your health. Bulimia. Bulimia can be fatal. Bulimia involves binging and purging. Bulimia can also involve starvation. This increases binge eating and purging desires. Binging is consuming a lot of food quickly. Binging makes people feel like they can't stop eating. To avoid weight gain, people purge after eating. Purging can involve vomiting, overexertion, starvation, or laxatives. To lose weight, some decrease insulin dosage. Bulimia also involves extreme self-criticism of appearance and preoccupation with weight and body form. Binge eating disorder. Binge eating entails eating quickly. Binging feels like eating without control. Binge eating doesn't cause purging. People may binge eat more or faster than expected. Even when full, eating may continue. People often feel guilty, disgusted, and ashamed after binging. They may fear weight growth. They may restrict eating for a while. This increases binging cravings, creating an unhealthy cycle. Binging alone might disguise embarrassment. Weekly binges are typical. Food avoidance disorder. Avoidant, restrictive food intake disorder involves severely limiting or avoiding particular foods. The diet rarely meets daily dietary requirements. This may affect growth, development, and daily living. This condition doesn't cause weight concerns. Instead, they may not eat or avoid specific colors, textures, smells, or tastes. They might worry about eating. They may dread choking, vomiting, or stomach issues. Avoidant, restrictive food intake disorder is more common in youngsters. The disease can cause severe childhood weight loss or failure to gain weight. Malnutrition can cause serious health issues. Doctor's appointment? Eating disorders are hard to overcome alone. Early therapy improves recovery odds. Problem eating behaviors that don't satisfy the criteria for an eating disorder can occur. Problem eating still harms health and well-being. If you think you have an eating disorder or have trouble eating that causes you distress, get treatment. Requesting treatment for a loved one. Eating problem sufferers may not believe they need treatment. Many eating problems involve ignoring symptoms. Guilt and shame also inhibit help seeking. Encourage a loved one to see a doctor if you're concerned. Even if they don't acknowledge to having a food problem, you can start the conversation by showing concern and wanting to listen. Eating disorder warning signs include avoiding food or making excuses, having a restricted diet without medical supervision, too much concentration on food or healthy eating, especially if it entails skipping sports banquets, birthday cake, or dining out, cooking instead than eating family meals, avoiding socializing, frequent and continuous concerns about health and weight loss, frequent mirror checks for defects, repeated overeating, using weight loss pills, laxatives, or herbs, extraordinary exercise. This involves skipping rest days, illness days, and social activities to exercise. Vomiting causes knuckle calluses. Vomiting-related teeth enamel loss. Using the restroom during or after meals. Discuss eating-related melancholy, disgust, shame, or guilt. Secretly eating. Contact a doctor if you suspect you or your child has an eating disorder. Refer to an eating disorder specialist if necessary. Contact an expert if your insurance allows. Causes. Eating disorders have unknown causes. Causes include genetics. Eating disorders may be genetic. Biology. Brain chemicals may cause eating disorders. Risk factors. Eating disorders can affect everyone. Teens and young adults develop eating issues. They can happen at any age. Factors like family history. People with eating disordered parents or siblings are more prone to develop one. Other mental illnesses. Trauma, anxiety, sadness, OCD, and other mental health difficulties can lead to eating disorders. Starvation and diet. Frequent dieting, especially when weight fluctuates with various diets, can lead to an eating problem. Most eating disorder symptoms are caused by malnutrition. Starvation alters emotions, thinking, anxiety, and hunger. This may make it hard to return to healthy eating habits. Weight bullying history. Weight-teasing victims are more likely to develop eating disorders. Peers, healthcare experts, coaches, professors, and family members can shame someone for their weight. Stress. Change can be stressful, whether it's college, moving, a new career, or family or relationship issues. Stress increases eating disorder risk. Complications. Eating disorders cause several serious health issues. Serious problems are more likely with severe or long-term eating disorders. Examples include major illness, depression, anxiety, suicidal ideation, development issues, social issues, drug abuse, work, school difficulties, death. Prevention. Healthy nutrition can help prevent eating disorders, but there's no guarantee. Help your youngster avoid eating issues. Healthy dietary and lifestyle practices for adults. Eat entire grains, fruits, and veggies. Limit salt, sugar, alcohol, saturated fat, and trans fats. Avoid starvation. Discuss a weight loss plan with your doctor or dietitian. Avoid weight loss pills, laxatives, and herbs. Exercise enough. Get 150 minutes of aerobic activity like brisk walking per week. Choose activities you enjoy so you'll do them. Seek help for depression, anxiety, self-esteem, and body image concerns. Health.gov has nutrition and exercise advice. Discuss your food habits with a doctor. Early therapy prevents worsening. Children. Helping your child eat healthy. Diet away from your child. Family eating patterns may affect children's food relationships. You may teach your youngster about diets while eating together. It also shows if your youngster is eating enough and variety. Tell your youngster. Many websites and social media platforms promote harmful concepts like anorexia as a lifestyle choice rather than an eating illness. Some sites promote teen diets. Correcting misperceptions is crucial. Discuss the dangers of unhealthy eating with your child. Promote a positive body image in your child, regardless of size. Discuss self-image and reassure your youngster that body shapes vary. Don't criticize your body to your child. Acceptance and respect boost self-esteem. They can also build resilience, the ability to bounce back from setbacks. These abilities can help teens and young adults cope. Ask your child's doctor. At well child checks, doctors may spot eating problem symptoms. Ask kids about their dietary habits. Height, weight, and body mass index checks can alert you and your child's doctor to major changes. Help out. If you suspect a family member or acquaintance has an eating disorder, express your concern. You may not be able to avoid an eating issue, but showing compassion may encourage treatment. I hope this video was informative. Please like, share, and subscribe. Thanks, buddy.